Welcome to Forbes Talks. Joining me now is Alexandra Levine, technology reporter here at Forbes. Alexandra, thank you so much for joining me.
Thanks so much for having me, Brittany.
You recently reported that some doctors and nurses are losing their jobs over the content they're posting on social media. Can you explain why?
It's a very complicated issue because even 10 years ago, when social media was very new, the biggest problems that you'd be running into with any medical professionals using social media outside of their jobs would be HIPAA. Today, medical professionals are very aware of HIPAA and what the law is and how social media and posts on social media may violate it. What's happening though is a lot of medical professionals are finding themselves in these sticky situations where they're either having disciplinary action taken against them or being fired altogether for things that are not so clear cut as a HIPAA violation. Things like monetizing some of their content, their health content on social media, things like potentially creating conflicts of interest with their practice. But these are things that don't necessarily have, clear guidelines or rules written into social media policies or employment contracts.
Something that you wrote that I found interesting was, quote, as more Americans turn to social media for health advice, medical professionals who double as influencers are towing tricky ethical and professional lines. Where is this line?
There are no clear answers. I think that one thing that I learned in speaking to people is that medical practices different across different fields, medical practices in different locations, medical practices that have, varied levels of medical professionals in them, whether it's an MD or a DO or an RN or an NP, a nurse practitioner, they all have different rules. And even though there are some big bodies like the American Medical Association or the American Nurses Association that put out guidelines, the guidelines are really broad and they talk broadly about what is an ethical line and what isn't. I think broadly, the answer to your question is ethically, you're not supposed to cross lines with patients. Medical professionals are not supposed to cross lines with patients, and they're also supposed to maintain, a professional. They're supposed to carry themselves professionally on social media, but beyond that, it's very difficult to define exactly where the ethical lines are because it varies so widely, based not only on opinion but on what field you're in, what part of the country you're in, what kind of a medical practitioner you are.
So let's say you're a healthcare worker and you start a new job. Are these policies laid out for you, or do they come up once you become a content creator and your employer sees your content?
I think, again, in speaking to all these creators, it seems like it's really a mix of those things, which is why it's so challenging to address. I think for some people, including one nurse practitioner who specialized in dermatology who I spoke to, it seems that there was no clear language in her social media policy about her social media use, but that in her employment agreement, where there's language about conflict of interest and creating competition with the practice, that was ultimately what led to her termination, even though on the surface that has nothing to do with social media.
Can you lay out for us some of the benefits of doctors posting to apps like TikTok?
Absolutely. Well, we know now that 1 in 5 Americans that are seeking help with a health issue are going first to TikTok before they are going to before they are waiting to go to a medical professional. So longer the days where people going in for their once a year visit would wait, potentially 9 months or a year to go and ask their medical question. They're turning to social media platforms, and part of the benefit of these platforms is that they can reach so many people, including people in parts of the country that don't have easy access to healthcare, or people who can't afford healthcare, healthcare altogether. Social media platforms like TikTok are very much democratizing that. The flip side are the dangers inherent with that, right? Because all of these different platforms have different policies for health information, how you deal with health mis or disinformation. And I think that the inconsistencies between those policies, and also there being lots of people who are not actually licensed medical practitioners that are trying to share a lot of health advice on these platforms, and it not being clear kind of who is credentialed and who is not to the average person who's popping open their app and looking at their feed, I think that's where you run into dangers.
And do you think the benefits here outweigh the risks?
It's very hard for me to say. I can't opine on whether the benefits outweigh the risks, but I do think that with the rise of TikTok being one of the most popular search engines in the world, and with the fact that 1 in 5 people are now going to platforms like TikTok before they're seeking help from a medical provider, I think it is incumbent on everybody to at least be able to have the conversation about how there can be benefits. Whether the benefits outweigh the risks, again, is not for me to opine on, but just being able to have the conversation about where the lines should be drawn, how the lines should be better communicated, and also not just fully dismissing medical professionals who use social media as something that they shouldn't be doing, but really trying to get the perspective of people who are very well versed in their fields, who are licensed professionals, and who have been using it in a responsible way, and trying to understand from them what sorts of benefits it has, what kinds of populations they've been able to reach, who they've been able to educate about whatever various procedures they may be able to offer that wouldn't otherwise know. I think it's important to at least start having those conversations, whether we know that the benefits outweigh the risks or not.
Obviously, the line is crossed when it comes to violating HIPAA, but are brand partnerships crossing the line?
There are no clear guidelines around this. Again, this is part of why, part of what we highlighted in the article was just that there are no real guidelines around this, and that's why it's so tricky. Of course, there are certain laws that exist to prevent medical practitioners from getting kickbacks on pharmaceuticals, for example, that they might recommend. But by and large, if somebody who is a dermatologist or a licensed nurse practitioner in dermatology, like the one who we featured in the article, if that's a person who is just recommending over-the-counter drugstore products, whether they're collecting money from that or not, is that a problem? It's absolutely not clear, and many people have differing views on that. That said, one of the people who we interviewed for the story, who is overseeing, he's a practicing cardiologist who's overseeing all of Google and YouTube's healthcare work. He is somebody who, again, himself as a practicing cardiologist, he sees the value in medical professionals actually being paid for what they are putting on social media, because all of these creators, one thing they say in common is that it takes a lot of time to put this content out there. It takes a lot of time to ensure that there's good authoritative content out there. And the perspective of the guy who's overseeing YouTube and Google's health arm is that doctors are paid for their valuable input in real life, whether it's, in the surgery room or it's in the office. And they should also be paid, in his perspective, for the time that they are putting into putting things out on the internet for the greater good of the public, to better inform people about their health.
Based on who you talk to, what has the response been from healthcare workers over these kind of blurry social media practices and policies?
Healthcare workers overall have said that it's incredibly frustrating and that it needs to be talked about more, which was, part of what we highlighted in the article was that the three main reasons that healthcare providers are looking to get into social media outside their day job in the first place are really, 1, to reach more patients, 2, to make extra money outside of their jobs, and 3, to also have a creative outlet where they can be sort of humanized and be themselves outside of the day-to-day stressors of their job in medicine. And I think that the resounding, overarching message that I got in speaking to creators who have tried to do this and have run into issues with it is there really needs to be more conversation about kind of where we go from here and the possible benefits, and how we can ensure that if we are pursuing social media outside of our jobs, that the risks are not going to outweigh the good that they can do with these platforms.
Do employers really have any legs to stand on when it comes to firing healthcare employees based on these half-baked policies that they come up with?
Well, again, it's not for me to opine on that, but I think that employers are trying, in many cases to re-examine these policies. They are trying to update the policies. I think a lot of times what happens, though, is that technology is advancing so rapidly, and new platforms are coming up so frequently and becoming so viral so quickly. I mean, look at TikTok. Even just a few years ago, it really wasn't on the radar of many people in the United States. I think what's happening is that these practices, medical schools, these medical organizations are well-intending and well-meaning in the sense that they do want to figure out how to put social media policies into place, how to enforce them, how to make them a little bit more granular so that they're not just telling people, don't violate HIPAA or be sure to be professional, which is extremely broad. I think that despite these good intentions, the technology is so rapidly evolving that it's creating more specific policies for the medical providers or for the hospitals, for example, to sort of hang their hats on. It's making it really difficult to do that.
From who you've talked to, is there any indication that these policies will catch up anytime soon?
It seems like the fact that, YouTube, which has YouTube and Google, which again, their health arm is being run right now by somebody who is a former high-ranking government official who worked at the Department of Health and Human Services, who also is a practicing cardiologist himself, and who now has recently launched this program where YouTube is going to be elevating and labeling and boosting videos that qualified medical creators are posting to the platform. I think that we are sort of at the beginning of these policies being revisited. If anything, we're sort of at the beginning of them being written all together, just because the policies that exist now are the same ones that really existed, within the last 5 or 10 years. And we're in a completely different technological landscape now than we were even 5 or 10 years ago.
Alexandra, thank you so much.
Thanks so much for having me.